This is Boomer Life on CL 650.
Welcome back to the program. Nice to have you on this Saturday morning as we talk about back pain with our specialist from False Creek Healthcare Center in the persons of Dr. Navaj Heron on the phone, and in studio with me, Dr. Stephen Helper, who is a physiatrist at False Creek Healthcare Center. Dr. Helper, you were going to tell us when we came back from the break about some of these. We're talking back pain, which is very, unfortunately, regrettably common among boomers. It's just an age thing as much as anything else, complicated by various other factors. So when you have moderate back pain that's chronic, you were going to tell us about some of the possibilities that are out there for us.
Right. Well, the topic came up when we were talking about can we just turn off that nerve? And
I asked you about that.
Yeah, I suggested that turning off a big nerve to your leg is probably not a great idea, and if I did that, it's probably by accident. But really, there are some structures where we do on purpose turn off the nerves as the treatment. And it applies to this term we just keep bouncing around today is facet arthropathy, or arthritis of these little tiny joints in the back. This type of pain can just be a moderate nagging pain that can affect us often over age 50. It doesn't have to be such, but it often does. And the treatments that we try to get strong, we try to get fit, we take medications, we try injecting steroids under x-ray. That can be disappointing.
Mm-hmm.
The real best treatment is to put a fancy probe right down next to the little tiny nerve endings that go to the joint. So not to treat the joint specifically, and not to treat a big nerve that goes to your leg, but to put a probe down to the little twig nerve that goes to the joint, and use a fancy probe and use a current and actually burn that little nerve ending and turn off the sensation to the joint for a year or two at a time.
Okay.
Right? So that is just a very small, precise needle that can have that wow effect by just turning off the nerve and just really injuring that little nerve on purpose. But because that nerve isn't very important for other reasons, it's not going to your leg and controlling major muscles, it doesn't affect your life, and all you feel is pain relief.
Interesting stuff. Dr. Heron, I have a question for you. I have a friend who's a carpenter. He's a hard-working guy who spent his whole life working with his hands.
Yeah.
And he has his back, and it's his word, goes out on him every now and then, and the pain is excruciating. He has to sleep on the living room floor. It's just, and then he's fine. He's back up on his feet, bouncing around and he's good to go for another 3 or 4 months, and then out of the blue, bang, his back, again, quote, goes out on him, and he's just down for the count. What do you do with someone who comes to you with that sort of condition?
There's common scenarios. We see those patients all the time, and they're the ones who are most frustrated. Well, one of the most frustrated with how their clinical course over years has gone by. 3 or 4 episodes a year, fairly typical. They've had it now for 10, 15 years.
Absolutely.
And it's getting worse every time. Each episode's getting longer, and they just want something done about it.
Yes.
Those are the patients we actually feel helpless with most of the time. Most of those patients will either have their pain as a result of myofascial or muscular strain injuries, or, again, from the facet arthropathy. They do a twisting movement or an activity, and they injure those facet joints. They become inflamed, and eventually that cycle of inflammation eventually settles down, and then they can get back on with their life.
Right.
And you can't realistically, you could try, inject these patients and do all these interventions on them in a timely basis to get them better. But most of the time, by the time they get any interventions done, they're going to be better already in the first place.
Exactly, because it just seems to be he's sort of off, just right out of sorts for anywhere up to, say, 2 to 3 weeks.
Yeah.
And then it's as though it never happened to him. He's good to go, and he doesn't play sports anymore or any of that kind of stuff. He's reduced the risk level in his life and in his activities, but then just out of the blue, one day when you least expect it, he's just completely debilitated.
Yeah. And that's very important to know that he's perfectly fine in between. Although he may be modifying his activities in life, lots of us do to prevent things from occurring.
Sure.
But the fact that he's asymptomatic in between those episodes is a real important factor. There's some patients who are never asymptomatic, and they'll always have a degree of chronic pain in that area.
Right.
A perfect situation would be somebody who has a really bad disc, and they have what we call discogenic back pain. Wraps around band-like across their lower abdomen. Say they have an L3-4 bad disc, and they're worse with sitting, they're worse with bending forward, brushing their teeth, washing their dishes, and every once in a while they get these bad, severe flare-ups, and they're just like him, and it takes them a few weeks to get over it, and then they're back to that same baseline pain. Those are patients we can help with.
Oh, okay.
We have options for dynamic stabilization. You can put in interspinous devices in between the bones. In that case, it would be between L3 and L4. They go between the bumps in the back, which are called the spinous processes, and wedge in between. They distract that space open, and because they're made out of silicone rubber, they prevent compression as well. So you get a reduction of about 50% in motion at that level, which often equates to about a 70% reduction in pain in these patients.
Interesting stuff. So for a lot of us boomers, especially guys who tend to sort of, well, suck it up, princess. It's the way you play the cards you're dealt, and you walk around spending the last 20 years of your life in really outstanding amounts of pain and taking, sort of suffering for what? Machismo? I don't think so. But so there are, Dr. Helper, there are things that can be done for chronic pain. We don't have to live with chronic pain as much as some of us seem to think we have to. We're resigned to it.
Yeah, I think it's most important for people to understand their options, because first of all, there are much more options out there than people know about,
right.
And there is hope. And for those that don't, for those who have the tough case that isn't going to respond no matter what the therapist does, no matter what the doctor does, knowledge and reducing the fear, you're going to reduce your pain by 20 to 30% just by reducing the
just because
fear.
You know what's going on.
Just because you know what's going on.
Sure.
Yeah, for sure.
And of course, the hope is, and that's the message that we do when we sit down with our friends from False Creek Healthcare Center. We talk about hope, and it's offered by an enormous staff of incredibly accomplished individuals, including our two guests today, Dr. Stephen Helper and Dr. Navaj Heron. I thank both of you gentlemen for being with us today. It's been a most educating hour, and my back feels better already.
See, it works.
Well, Mr. Fox, I hope we were helpful for you.
You were most edifying. We appreciate it a great deal. And we'll see you next time, right here on Boomer Life.